Good afternoon, and thank you for coming back. So my name is Susan Rumisha. I'm from the Telethon Kids Institute. I'm a biostatistician and epidemiologist. I work with a kind of a newly established group there. It's called Geospatial Health and Development, where we are doing advanced modeling of large data with focus with infectious disease, but particularly malaria globally, and also COVID. So I'll be chairing this session, which is our last session before the post-conference networking drinks. So I'll ask you to stay until the end of the final program. So we have 5 presentations, and we'll be taking questions after each presentation. So prepare your questions once the presenter is on the run. So I'm going to introduce our first presenter, Professor Jonathan Carapetis. Professor Carapetis is the director of the Telethon Kids Institute in Perth, Western Australia. He holds separate qualifications as a medical practitioner, specialist pediatrician, specialist infectious diseases physician, and also specialist public health physician, as well as a PhD. So welcome, Jonathan.
Thanks very much, Susan. So today it's been fantastic hearing those sessions in those talks in the previous session, and a bit like Chris, and I guess Sean as well, I'm wanting to maybe not focus too much on the science and the data, but perhaps in this talk to just give you a perspective at an institutional level as to how we've managed to navigate the last year and how we decided on what our priorities should be. And like everyone else, we were kind of unsure what we were going to get into in March last year. And I recall the last time we had an all-staff meeting, which was in kind of early March, when we had everyone together, and I was just using my usual updates. But at that stage, we knew that there was something going on, and there was also this question as to whether we were going to be stopping international flights coming into this country and international flights leaving. And I remember saying to the staff, we're actually going to stop you being able to travel internationally, thinking that was going to be, that was a pretty big step to take. But then, of course, within a week or two, we were all in lockdown. And so what I'm really wanting to do today is to sort of take you through how we decided to manage this at the Institute. And we, in those first few weeks, really connected with our board and said, what are we potentially up for here? And the big thing we said was that whatever we were planning to do in 2020 was out the window. We needed to relook at our priorities, and we focused down on 3 priorities for the entire year, and they became my KPIs for the year as far as the board's concerned, one of which was to keep Telethon Kids Institute alive and surviving, that we wanted a viable institute into the future, that we wanted to avoid significant staff losses. We wanted to not have to lay off many staff. And this is probably the most important for today, that we wanted to feel like we were making a contribution to the battle against COVID. And those were the 3 things we said we wanted to do. And about that time, when it came to the last one, that I remember talking to Fiona Stanley, and we were really worried. And you all recall back then how when the first announcements from the Prime Minister came, and he said, I'm going to go to the rugby league tonight. And we all kind of shook our heads and said, what are you doing? And it took him a while to realise the gravity of the situation. Well, the same story was happening here, when a lot of us, and I'm sure most of you in the room, were really worried about what we were hearing from overseas, about what this virus was likely to do. And we were having messages that were being conveyed through government channels to the people of Western Australia. But I remember driving down past Matilda Bay, and people were out having picnics, and they were in their 50s and 100s, and it was as though nothing had happened. And I remember talking to Fiona saying, we've got to do something. And that's when it really occurred to us that as an organisation, as a large research institute that's got a significant profile in the community, that one of the things we could do is to use our voice to try and reinforce some public health messages and connect with an audience in a way that maybe government messaging might not, that we could augment and complement the government messaging. And so what you've got there is an open letter that Fiona and I published to the Western Australian people in the West Australian. And that was one of the many things that we did to try and really, and so this letter just tells people this is serious and we want you to practice social distancing and practice hand hygiene, and we want you to be nice to each other because we're in for a really tough time. And that was one of the things that made us reflect on one of the things that we can do as an institute is to really try and communicate to our community. And I'll come back to that. The other thing we realised we could do, and we could probably do fairly well, is to do research. We're a research organisation, and so you've heard of some of the amazing projects that happened, and we also did the same thing. And I remember putting it out to our researchers that we want you to think of what you could do as researchers with amazing skill sets that could make a contribution. And I was amazed at what I saw. And it's a bit like what we heard in terms of the collaborative piece, that researchers who'd never worked together came together in little working groups and started brainstorming ideas that would be really important. The other thing that we are very proud of is, and the work that we've been involved in for many years around consumer and community involvement, and obviously the Health Translation Network's got a very strong record in this. We charged Anne McKenzie to pull together a COVID-19 community advisory group, which happened again, almost overnight. We've heard so many stories about what happened overnight, and this was one of them. And she managed to pull together 22 experienced community members, and they came from across the country. You'll see about half from Western Australia, but a lot of them from around the country. And they just made themselves available to do consultations around research ideas that were bubbling up, not just within Western Australia, but nationally. And so they were mobilised around a whole lot of projects around the country. They had input into more than 20 projects. They had lots of meetings, I think of 455 cumulative hours of work they put in, all voluntary, all unpaid. And this is really critical. We heard about the speed of research. We heard about the amazing effort that our ethics committees put in. I was so impressed at how we got this rapid turnaround. Same thing with the consumer involvement. None of this slowed any single projects. They worked through the night and they didn't cut corners. They gave honest and frank feedback. And we've got some comments from researchers that they were really impressed with the rapid, comprehensive, constructive feedback that was provided to them. They found that incredibly valuable. And the members, these consumer members also were very proud that this was a way of showcasing how consumer involvement improves quality of projects and is not an impediment. It actually streamlines things. So that was another example of how COVID has helped us to change the way we work, and I'm hoping that some of this we're going to be able to continue later on. So we did get involved in a number of research projects. I'm just going to give you a quick taste of a few of them, and I'm not going to delve deeply into the science. You've probably heard about the BRACE trial. The BRACE trial was, again, one of those incredibly collaborative projects. It's built around the concept that the BCG vaccine offers a whole lot of off-target effects that include evidence of protection against viral infections, and that includes the likelihood of COVID infections. And so this idea that using the BCG vaccine, we could actually prevent people from getting infected who are going to be exposed, and the obvious targets were healthcare workers. And this was a project that came out of the Murdoch Children's Research Institute. Toby Coleman was one of our researchers who was involved and who's been very interested in these off-target effects of BCG vaccine. And so the idea was that we were going to enrol thousands of healthcare workers in a randomised trial of BCG plus flu vaccine versus flu vaccine alone, and then document the impact on transmission. And what I was incredibly impressed with, firstly, was that we got generous funding from the Minderoo Foundation to get this kicked off here. The network that was established with Fiona Stanley Hospital, with Charles Gardner Hospital, with Perth Children's Hospital, and we got from idea to healthcare workers being enrolled, 21 days, 100 different staff and students and volunteers were mobilised, and we managed to, or the team managed to, enrol and immunised 1,834 participants within 2 or 3 weeks here in Western Australia, well ahead of what was happening over east. Since that time, the Bill and Melinda Gates Foundation has come on board. It's become a global trial, obviously, because COVID largely disappeared from Australia. But it's important to know that the Australian enrollees are playing a critical role, both in terms of acting, if you like, as controls for the global study, but also because within that, they're able to look at some interesting questions around the impact of BCG on flu vaccine. And that study is now happening in multiple sites around the world, and we should be seeing some interim analyses in the next 2 months. This one, the Concord 19 study, and again, Toby's there with Steve Stick from our Walyan Respiratory Centre. This was an idea built around the observations that occurred in January. Toby was part of this with a range of collaborators, including people from Eleanor Fish from the University of Toronto, collaborating with people in China. They actually were in Wuhan, where they did a trial or observed the impact of interferon treatment on people with COVID in hospital, and observed that those who were treated with interferon had the duration of their excretion of COVID was reduced by about a week. And that would fit with the antiviral effects of interferon. And so the concept was born of a trial where you could see whether interferon given to both people who are infected but also their close contacts could be used to reduce transmission, essentially trying to augment the public health response. Recognising, and what you're gathering is that we recognised that there was a whole lot of work happening around treatment of COVID, and you'll hear from Steve Webb about one of those studies very soon. What we wanted to do is to look at that question about how we could reduce transmission, not just with BRACE, but now with this one. It actually had a different name when we started, and we had to change it because, obviously, COVID went away. We got amazing funding from BHP, we got things mobilised, COVID disappeared. And so what we did was looked around the world at a place, to find a place where they had ongoing COVID infections, but they weren't overwhelmed, so that they were still able to do research in a way that we knew, in a setting where we had confidence that the collaborators could do a high quality research project. And we landed in Chile. And in Chile, we've got, again, they had just the right mix in terms of the numbers of COVID cases, but they were able to cope with research and high quality research collaborators. Unfortunately, the previous name we had chosen for this study, COCO, doesn't translate so well into Spanish. Evidently it means testicles. So we decided we had to change the name, so it's became Concord 19. Anyway, that study is underway. They've got about 300 families already recruited. We should be getting results in the next couple of months. And again, that study is being operated out of Perth with recruitment happening in Chile. The samples are coming back to Perth for the multi-omics analyses. And then, of course, closer to home, we heard about Detect FIFO from Chris. This was the Detect School. So this is this background of a program of research aiming to encourage and to support local industries or other services, in this case the education sector. And this was a partnership with the Western Australian Government, the Health Department, the Education Department, were particularly important here. We had Pathwest involved, we had Country Health Services, and the aim here was to really understand what was happening out in schools, in particular was there COVID transmission happening that we weren't aware of. And we took the opportunity also to do a well-being survey, so that we wanted to really understand what the impact of the COVID pandemic was on kids and families. And what you'll see there is that, again, this was a project where we involved 40 schools around the state, took almost 14,000 COVID swabs, and as you'd expect, 0 of them were positive, and that's, I guess, providing some reassurance that there wasn't undetected virus out there. But also the wellbeing survey was pretty impressive, and we've got some great data from that wellbeing survey. I think I had half an hour on the list. I do. I have half an hour. So I've just been having the 3 minutes thing. So I've got a bit longer than that. So the Detect Schools project has great data on what's happening in kids. Now, none of it's surprising. We're working with the department so that we can get these data out there, but it's a bit like what Sean told you. We know there's a lot of anxiety out there, but we want to really equip children and families to be able to manage what's happening with the pandemic, even though we don't actually have virus here. We did a number of other studies across the Institute, so looking really from trying to save lives through to mapping what was happening and to reduce the impacts on families. So we've been collaborating around development of diagnostic tests, other mental health research. We've been looking at models of care for chronic disease in children. The Origins cohort out at Joondalup has been doing some community wellbeing surveys. So again, taking the advantage of existing cohorts to build in research around COVID. We also wanted to understand the impact of working from home on our staff and students, and so we did a project around that, which is now linking with Sharon Parker and her work at Curtin University to really augment what their experience has been in how to manage working from home. And also we've been working with emergency departments around their infection monitoring. But then it gets to the last two things I want to talk about were, again, how we managed running the Institute. So I think in the first lockdown, we learnt a lot about it. We probably overreacted, as most of us did. So we sent everybody home. We were very fortunate that we were very well set up for that. So everyone was on laptops. We had a pretty good IT network, so people could go home, work through Teams, and that happened virtually overnight. I was amazed at how well mobilised our Institute staff were. We also made a very tough decision to essentially put almost all of our research on pause. And that was for a couple of reasons, one of which is we really wanted to make sure our staff were safe. We wanted to anticipate that virus could occur, and we wanted to be ahead of the curve there. But also because of our position in the community, we wanted to be seen to be doing the right thing. And so we for the first 6-week lockdown, we really had very little research happening. Obviously, some of it couldn't happen. Clinical research couldn't happen, couldn't get into Aboriginal communities. But even our laboratory research had to essentially go on pause. We managed to keep people connected through really intensive communication, and we did lots of all-staff forums on Microsoft Teams or others would use Zoom, and that's been a revelation because it's actually been a fantastic way of connecting with all our staff. The meeting where you would have a talk to your people in person, usually less than a third of your staff can actually get there, and the rest of them kind of miss out. This sort of forum, they can all connect, they can all ask questions, you can have a real question and answer. It's something that we are continuing, even though we now can get together in person. This has been a really effective way, and we've received lots of positive feedback about the fact that as soon as there was anything happening, we got onto this sort of thing and communicated with our staff. This is what we understand to be the impact on us and how we're going to work. And it also meant that we could get feedback, and we got feedback from our researchers that said, you know what, we probably can do it different next time. And so the two subsequent snap lockdowns we've managed to keep all of our research going. We had a very well worked out COVID safe plan that meant that we could keep our research going, and that's been fantastic. And then we got onto this community engagement piece, which goes back to what I said earlier. This is what could we do as an institute that could provide some value to the Western Australian population? And we've done it in different ways. So this picture is from actually just a week or two ago where we had a community seminar, which was a question and answer seminar where Chris Blythe, who's the co-chair of ATAGI, the Australian Technical Advisory Group on Immunisation, Leanne Kirkham, who's the co-director of our Westpharma Centre for Vaccines and Infectious Disease, and I just did questions and answers from the audience about COVID vaccines. And they loved it. We've done this for our corporate partners where we'll have over 100 of them around the country on a webinar, and they can just ask whatever they want from us. We're about to have another one tomorrow, a much more community-focused webinar, again, on COVID and kids and families. So we've realised that we could offer expertise and in a way where people could just ask questions and get answers. We've had a big focus on Aboriginal communities and our Aboriginal staff. So I did a question and answer a couple of weeks ago with all of our Aboriginal staff about COVID vaccines. vaccines. I don't know if you're aware, but there's a huge amount of vaccine hesitancy in Aboriginal communities, certainly in the north. We're just trying to find out more about it. And that was true of our Aboriginal staff, but they just had an hour or an hour and a half with me asking questions. I was able to give them the answers that I was very aware of, and I think that's been very reassuring for them. We produced a whole lot of resources, and this is again because we connect with an audience that sometimes doesn't respond so positively to government messaging, but we could do it in a way that provides information particularly focused on kids and families, and there's a whole lot of different resources, and you can go onto our website and get access to these. We push them out through our social media channels, and we saw a huge uptake in our social media presence, which was all focused on how we could get valuable information out. All of this was complementing government messaging. At no stage were we doing anything other than reinforcing the message around public health that was coming from government. And then there are other ways that we could be seen as trusted advisors. So I've mentioned ATAGI, which is on the right. So Chris is part of ATAGI. I'm a member of the National COVID Health and Research Advisory Committee, which has been an interesting experience. I've learned a whole lot. So that's a piece of work that I chaired the committee on, which was about airflow and ventilation systems in hotel quarantine. Never knew anything about that before, but I know a lot about air conditioning now. And this has been, I think, something that we've been able to do that has hopefully offered value, but it's also given a few of us access to some information that then we can transmit out to others in different ways. Other things we've done, that some of our modelers have been involved in the sort of ad hoc advice to the governments, both state and Commonwealth. We've offered some of our staff, I can see Dylan Bath here, so some of our staff actually went off and had secondments to the health department to assist with the state government response. Lots of ad hoc phone calls. Chris Reid talked about the incredible work with the mining sector, which I think points out a gap in how Australia responds to pandemics, one that we need to do better. Because we've all seen that the sort of work that Chris was involved in helped to keep our economy moving, which has been, I think, virtually as important as the public health response in how well Australia is situated right now. We had lots of others, so I spent a fair bit of time talking to Rio and BHP in those early days about how they were going to run their FIFO. I had the people from Wesfarmers contacting me. I want to keep Bunnings open. I want to do it in a safe way, but I can't get anyone in the government to talk to me because they're too busy planning for a pandemic. So we worked a lot with some of these companies about the sort of advice that we could give about, yep, that seems to make sense, or no, I would do it this way. I think we need to make sure that next time businesses, whether they're large or small businesses, have a go-to place where they can get advice, and that needs to be probably separated from government, because government has enough on their plate when they're managing a pandemic, and that's something that researchers can do. We did a lot of media. I just realised I'm wearing the same outfit, so I apologise for that. But we did a lot of media, and again, that was about making sure that people knew that there was a community of researchers, a community of scientists that were willing to share the latest science, and that could get it out into a whole lot of different audiences. That, I think, has been a really important part of giving people confidence about how we're navigating this pandemic. And so I'm going to finish just with an example of some of the resources we've put out there, because it was fun to produce some videos and things that were targeted at different audiences. And hopefully this gives you a bit of a sense as to the way we were able to connect with, in this case, kids. This is Asher Bowen, who's a paediatric infectious disease physician, heads up the infectious disease department at Perth Children's Hospital, and was very involved in giving information about COVID earlier on. Hopefully this will work.
And I am 9 years old. My friends and I have so many questions about the coronavirus, so we sent them to the scientists at Telethon Kids, and here are the answers.
Hello, my name is Elspeth and I am 5 years old. I want to know how the coronavirus started.
The coronavirus started in China, in a city called Wuhan, a place many of us had never heard of before. And in that place was when the first episodes of this disease started.
I'm Jack and I'm 4 years old, and why is people scared of coronavirus?
People are afraid of the coronavirus because it's new for humans, and so that means no one has any protection from it. We don't have anything running around in our blood that can fight off this virus the first time. We're also pretty scared of it because it's infecting people really quickly, and also some of those people are dying, and that makes us really scared.
I want to know what it means if you don't have a good, strong immune system.
Our immune system is our fighter cells in our body that helps keep us healthy. So for people who don't have a strong immune system, that means that they're less able to have fighter cells in their body to fight off the infection, and so they might get a whole lot sicker.
All right, so that you can log on and have a look at the whole thing if you want. Plenty of other similar resources. And I guess the acknowledgement I want to make is that we've got 1,000, or more than 1,000 researchers and support staff and students at Telethon Kids who have really mobilised themselves and supported each other, as well as hopefully helped to support the response in WA. Thank you very much.
So thank you very much, Jonathan. So there's a mistake in the printing, so he was allocated half an hour. So we have time for questions. If anybody has a question for Jonathan, please introduce yourself and before you ask a question.
George Hill from Harry Perkins Institute. My grandchildren all want to get into medical research because of COVID. And I'm just thinking that there's going to be a wave of interest in the next generation of researchers. How are we going to cope in terms of these people going through the system? Already we're finding difficulty in supporting and funding the current crop that we have.
It's such a great question, George. And I can tell you that there's a working group of AMRI, Research Australia, the Academy of Health and Medical Sciences, which is really trying to revision the future of medical research in light of the COVID pandemic. And partly to do with how we work. Can we bring the learnings of the nimbleness, the responsiveness to emerging problems? But the big issue is we've demonstrated so well the value of investing in research in this country. We've been able to mobilise this incredible research response based on the fact that we've got 30 to 50 years of incredible investment behind us. If we're going to make the most of it in the future, then the big thing we have to deal with is our workforce. And so we've really started trying to figure out how we better support our workforce. Obviously, the priority number one is our early mid-career researchers, giving them some security, and that's been the priority for AMRI, and we're now working with ASMR and others on how we can perhaps do this in a different way, which is not just about saying government sort this out. It's also recognising that all of us who run organisations, universities, research institutes, we actually put a lot of our own resources into helping researchers who fall through the net. We pull them up with safety nets, we top them up. How could we use some of those funds in a much more formal way to leverage additional funds in, say, from government? Could we come up with twice the number of investigator grants that way? So we need to both secure the future of our research workforce, and then we need to also make sure that your grandkids get excited about a career in science. So no simple answer, it's a whole SOTS for itself, Gary, for next year, which is around how we make sure that we have the research workforce of the future to make the most of what we've seen in the last 12 months.
We have a room for just one question, if anyone.
Thanks, Jonathan. That's fantastic work. Just out of interest, but at the start of this, and we heard a little bit different from Jeremy a little earlier here, but was generally thinking this is not a problem for children. Did you get any sort of pushback? People saying, "Well, this is not your key area of interest. Leave this to the big people," or was that an issue at all?
Well, we did. We got some of that pushback. The point we made, firstly, is it's an issue for everyone, and so just the fact that we know that COVID now is probably emerging as a bigger problem in kids. But even then, the results of our health and wellbeing survey showed that kids are being dramatically affected whether or not it directly infects them or whether or not we even have COVID in our community. So we knew it was going to be an issue for kids and for families. We also knew, though, that we had some bloody good people, some amazing skills, some amazing talents. Our clinical trials mobilisation capacity was superb. And so we said, anyone who can be making a contribution to this pandemic should. So that's the response we put back.
Yeah.
But yeah, we did get a bit of pushback.
Yeah, thank you. Well done.
Thanks.
Thank you very much, Jonathan, so for that insightful